Hey, thanks for joining me here again in this Nutrible MD Podcast. I'm your host, Dr. Brandon Lip. If you're seeking wellness, happiness, and balance in your life, you're in the right place because all of the original content is designed to expand your horizons in an unconventional way. I incorporate all my clinical knowledge from my father's 50 plus years of experience and my own 25 plus years of helping people with various needs. In the last episode, we talked briefly about how many of us crave things which are harming the weakest parts of our bodies. Today, we will switch gears a little and talk about my experiences of helping people with depression and anxiety in the context of being alone or within a relationship. Let's begin. I remember a while ago, I provided some counseling to a patient who was trying to recover from a failed relationship. He and his girlfriend lived together for a number of years, but quote unquote, out of nowhere, she decided that it was not worth her time to stay in this relationship, picked up her bags, and moved out. He was pretty devastated. He had no energy, couldn't sleep, keep on thinking about things over and over again. He would go into uncontrolled crying episodes. I was his primary care for a little bit of time, so I understood his personality. He has always been a glass half empty type of person rather than glass half full. So, meaning that he would look at things in life usually in the negative sense before he would look at the positive sense. So, I knew a little bit about this patient already before this happened. So, with this traumatic breakup, he had some therapy outside and it wasn't helping that much. What I found is that when it comes to getting psychotherapy, finding the right therapist, finding that connection is so important. Now, if you see one psychotherapist and you don't get that connection, keep trying. There's going to be someone out there and will be able to make that connection with you so you feel that empowerment from their advice that they give. No connection, no empowerment. But if you find that connection, great. So with this patient, the previous psychotherapist that was helping him, unfortunately, there wasn't any connection. So due to transition time, finding another therapist, he asked for help directly from me. When it comes to situations like this, I usually want the patient going through the recovery from a failed relationship to understand their self worth. Remember, this patient had the type of personality where he would look at things in life usually from a negative sense before he would look at it from a positive point of view. So, with this type of personality, it was so easy for him to start placing a whole bunch of blame on himself. He would keep rehashing the different events that occurred during a relationship and look at what he could have done better, what kind of things he should have just given in so that the relationship could have been salvaged, could have been saved, so that this breakup wouldn't have occurred. When this occurs, it's so easy for someone to lose their sense of self worth. Without the sense of self worth, there is no going forward. So, how did I provide counseling so that he end up realizing his own self worth? Many times, it's helping the patient separate out the emotions. Even though during a very emotional state, if you approach it in a way where the patient feels connected to you, you can dissect out the emotions and have them basically reassess the exact same moments that they keep thinking about from another point of view. So when I sat down with this patient and revisited those specific instances where he thought he did something wrong, that he could have changed the way he acted so that less arguments would have occurred, less friction would have occurred. Well, when we revisited, taking out some of that heated emotion that was surrounding it, it was just basically a difference in opinion. He didn't do anything wrong. He and his girlfriend didn't agree. It's okay to have difference in opinion. Now, if there's a difference in opinion in many major issues, then there's a basic lack of compatibility. So when we sat down through different sessions and looked at these different instances and realized that no, he wasn't all to blame, it was a difference in opinion. Well, when we tried to trace back, they had a lot of differences in opinion. That compatibility was a little shaky already, a year or two into the relationship. And there were other red flags too. So when you're able to take some of that heated emotions out, start looking at it with some reasoning, with some basic foundation of what makes a healthy relationship. When we look at it that way and analyze if that relationship even had any hope of staying together, then we realize together for him to blame himself was really, really counterproductive. It was completely destroying his self worth, it was lowering his self esteem. He wasn't able to see things clearly because he kept on blaming himself. Now, once this patient started being able to recognize his self worth, the counseling goes into the next phase, which is helping this patient motivate to look forward. It's time to stop doing any more blames, especially blaming themselves. It's time to give the other person space. Stop reaching out, give them the space. This patient needed to work on himself to basically prepare himself so that he's more ready for the next relationship. Now, if both parties down the road want to rekindle the relationship because things have changed, so be it. But I think we have to take that as most likely an exception. Most likely, both parties move forward and they go their separate ways. And we have to prepare this patient to look forward. So, what kind of things can help motivate this patient? Social support, start doing things physically that makes him feel better. Basically, getting him on a schedule because at first it seems like everything's lost, especially when someone's vulnerable coming out of a relationship. They feel lost. They spend so much energy trying to save the relationship. They spend so much energy trying to rehash everything. They lost so much in Chinese medicine sense chi from just psychologically being burdened by this. They do need time to heal. So this time can be substantial. So you need to have that continuous motivation from a therapist, from their primary care. And that's what we did for this patient. He was able to find an additional psychotherapist and was able to have additional counseling where he had that motivation to start looking forward. Yes, he didn't need to continuously, again and again, reach out to his ex, trying to figure something out. He was able to move on to the next phase where he recognized his self worth, he recognized what was important for him, he recognized what were the red flags in the relationship. So he could live a healthier relationship the next time around. I mentioned earlier that this patient didn't want to use any medications for antidepressants or anti anxiety medications. He decided to try to use purely counseling to get through this tough time. However, he was open to trying some supplements to see if he could possibly get some sleep, get a little bit less anxiety, and therefore, at least it wouldn't be so tough for him when he goes to work to be completely drained that he could at least have a little bit better sleep. So there was one supplement I recommended to him that I think for people who are not on any kind of medications could definitely try and see. It's something called 5-HTP, 5 hydroxytryptophan. 5-HTP is produced from the amino acid tryptophan and is further converted in your body to, guess what? The neurotransmitter serotonin. We all know that tryptophan is essential and you must obtain it in your diet. We also know that serotonin is known as one of your body's feel good hormones. The three other known feel good hormones in your body are dopamine, oxytocin, and endorphins. Serotonin has the ability to regulate mood and is actually one of the key biochemicals that can purposely be increased by the use of antidepressants and anti anxiety medications. In fact, many of the popular doctor prescribed pharmaceuticals specifically increase the amount of serotonin in your brain by suppressing its reuptake. Reuptake is the process in which neurotransmitters are recycled, reabsorbed, or deactivated. So, since 5-HTP is ultimately converted in your body to serotonin, by using this supplement, you can increase the amount of this feel good hormone in your brain. But there's another great benefit to this 5-HTP. Another fantastic feature is that this increased amount of serotonin actually promotes the conversion into melatonin. You know, we all have heard of melatonin and its benefits in promoting and regulating sleep. However, I'm actually not a big fan of using melatonin long term. Why? Because it has to do with the natural phenomenon of how your body gets used to something and begins to create less of it. So, if you are supplementing with melatonin, your body gets used to this end product being supplied externally. So, therefore, there is no need to make more of it internally. It's like the body getting lazy. Since I'm being fed melatonin, why does my body need to actively make it anymore? I remember being taught an analogy years ago regarding medications and supplements. Let's say you have a chauffeur that usually drives you around town from point A to point B. This goes on for a while, let's say many years, but one day your chauffeur calls in sick and you are unable to find a replacement. If now you have to drive from point A to point B on your own, it wouldn't be as easy as it was when you had a chauffeur, right? Of course, these days you can call an Uber, but that would still fit the analogy because your body would need to figure out some workarounds or sidestep that inefficiency in some way. Guess what? This takes time. So, for the human body, if you supplement with a substance that is an end product of a biochemical reaction in your body, over time, your body produces less of this beneficial end product on its own. And that's not ideal. What's good about 5-HTP is that it is not an end product, but in fact, more of a reactant. It's just like what you learn in a basic chemistry course, Chemistry 101. In a chemical reaction, the more reactants you have, the more products would be favored. So, in a way, when you are supplementing with 5-HTP, you are encouraging your body to use more of the natural biochemical reaction to make more serotonin and to make more melatonin. Therefore, since the actual process of making melatonin is encouraged and encouraged to be more active, your body doesn't get lazy compared to if you were just supplementing melatonin chronically externally. So far today, we've talked a little bit about depression stemming from a breakup, the importance of recognizing self worth, and the 5-HTP supplement. So, how about what can we learn from the point of view of traditional Chinese medicine? What does Chinese medicine philosophy say regarding anxiety and depression? We will discuss this next. Over the years, many patients have come to my private practice asking for treatment and consultation regarding their depression, regarding their anxiety. So, what does Chinese medicine have to say about their depression and anxiety? How do we treat it? How do we recognize it from a Chinese medicine sense? What have I learned from helping these patients out? Well, the key takeaway point I want you to understand is that your emotions affect the liver organ system. Now, I touched upon this a little bit in the first episode, basically stating that the liver organ system in the Chinese medicine sense is not exactly the same as the liver in the conventional scientific medicine sense. Now, there is overlap. So, what the liver does in the scientific sense is incorporated in a poetic description within Chinese medicine. However, the interpretation of what the liver does is much more broad in Chinese medicine. So that's why we call it the liver organ system. I find a lot of correlation between the liver organ system, what it does in the Chinese medicine sense, with the hormonal system in the scientific medicine sense. So basically, the liver organ system incorporates a lot of features of the endocrine system. So, why do emotions affect the liver organ system? What does it have to do with it? We understand from scientific advances these days that many of our physiologic processes are heavily dependent on the correct amount of hormones, neurotransmitters, and biochemicals that allow our organs to talk to each other. When there's an excess or deficiencies of these hormones, well, guess what? There's going to be miscommunication between the organs. And as a result, you will have illnesses and symptoms to appear. We also understand that physiologic processes like blood pressure, your weight and your metabolism, your blood sugars, and also a woman's menstrual cycle is obviously dependent on hormones and hormonal balance. Well, how does emotions play into this? We know this clinically and empirically. So let's say, for example, I have a young woman who's going through significant amounts of stress. Maybe they went through some type of psychological or physical trauma, and they're under this tremendous amounts of stress. Well, one of the things that we see often is that her menstrual cycle changes. The period may occur early, may be delayed, or suddenly her periods may stop. So we have clear clinical evidence that stress affects a woman's menstrual cycle. We also see clear clinical evidence that stresses, emotions affect a lot of different physiologic processes. For example, when someone's really, really stressed, their blood pressures go up, their blood sugars go up. We know from science that stress raises cortisol levels. So, in a way, Chinese medicine's interpretation of how emotions affect the liver organ system is just a poetic way to describe how the mind interprets stresses, takes it, affects the neurotransmitters and hormones in our bodies, whether they have been discovered already or even hormones and neurotransmitters yet to be discovered. That the emotions or the stresses we're exposed to can easily affect our hormonal levels and cause hormonal imbalance. This is an extremely important point. Why? Because now we understand that the liver organ system is thrown off balance by extremes and fluctuations in emotions. So basically, someone going through depression, going through anxiety, going through heavy amounts of stress, no matter what the causes are, post traumatic, work stresses, breakups, deaths in the family, whatever the cause is, it throws the liver organ system off balance. And as a Chinese medicine practitioner, you address those imbalances. Look at which parts of the organ system, the liver organ system, is off balance. And if you start addressing each of these imbalances through acupuncture and or through Chinese herbs, the symptoms of extreme sadness, suicidal ideation, having difficulty breathing, chest pressure, having trouble sleeping, racing heartbeat, all of these can be addressed by looking at the which parts of the liver organ system is being thrown off balance by your emotions. So as you can see, by understanding this concept, it's where the treatment starts. An interesting feature about this is that Chinese medicine is very effective when used in conjunction with psychotherapy. So let's say this patient is already starting a conversation, already working with a therapist, already working with a psychologist, getting psychotherapy, or the patient who is thinking about starting psychotherapy, by adding in Chinese medicine, the results, the improvement can be accelerated. Why? Because once you have an improvement in your emotions, it reinforces balance back into the liver organ system. And when you have a healthier liver organ system, it produces less fluctuation in the emotions. With less emotional extremes, again, it reinforces back balance back into the liver organ system. So as you can see, it starts off a beneficial cycle. This is in total comparison with the vicious cycle with depression. When someone goes through depression, their emotional extremes causes the liver organ system to be off balance. And since the liver organ system is off balance, it causes even more mood fluctuations, more emotional extremes. And the longer you stay in that cycle, the longer the liver organ system gets harmed, the more severe the consequences. So, as you can see, the goal of Chinese medicine in treating patients with depression, patients with anxiety, is to bring the liver organ system back into balance, usually with the use of acupuncture. We want to stop that vicious cycle and introduce a whole new beneficial cycle to produce more stability in their emotions and a healthier state of mind. I would recommend acupuncture more so rather than the strict use of Chinese herbs. If you plan to use Chinese herbs on top of antidepressants and anti anxiety pharmaceuticals, I would say please be careful. There could be interactions between the meds and the herbs. You will need to find a qualified Chinese medicine practitioner who knows which herbs to use or not use when antidepressants or anti anxiety meds are on board. So, how do we detect someone has a liver organ system imbalance? How do we know which components of the liver organ system is off balance? Let's give you a little clue. We will talk about this more in future episodes, but one thing I would look for is something called a wiry pulse. I invite you to step out of the box and look at all aspects in your daily life never addressed before, because the answer you've been searching for could literally be right in front of you. With what you learn from my podcasts, you will develop the knowledge and the courage to face those health dilemmas and be the best version of you. Please subscribe and let me know what you would like to learn about, and I will do my best to provide you with the most practical and original content from all my experiences. Know that faith and fate are powerful, but you choose your destiny. Until next time.